Welcome to today's training session specifically for imaging providers. I am Teresa Kern. I'm a registered nurse and an InterQual certified instructor here at Comagine Health. Also participating in the training today from Comagine Health is Lisa Lane. Lisa is the non-clinical manager, and Yvette Stratton is the Director of Care Management for the Alaska contract. We also have from the state of Alaska, Susan Duncan, the Alaska Medicaid Program Specialist. Qualis Health and Health Insight joined forces in 2019 to do great things. Together, we're reimagining healthcare. We are a national nonprofit healthcare consulting firm working collaboratively with providers like yourself and other stakeholders to reimagine, redesign, and implement sustainable improvements in the healthcare system. Our mission is to work together with our partners, again like yourself, to improve health and create a better healthcare system so that people in communities will flourish. We currently provide care management, system-wide quality improvement, consulting and research services, along with health IT and analytics. We have been providing care management to Medicaid and other private contracts since 1984. We currently have locations across the U.S. from Alaska to the District of Columbia. Currently, we have a contract with Alaska Medicaid to provide select services. We review imaging, pre-service surgical, initial and concurrent inpatient stay reviews, along with retrospective reviews for both inpatient and outpatient services. We utilize InterQual criteria, state guidelines, and organizational policies to conduct medical necessity reviews. We're available by phone or through the provider portal to assist providers with authorizations or system access questions. This is one of my favorite slides. We do not receive financial incentives to deny or to limit service. We review for medical necessity and appropriateness using evidence-based InterQual criteria, organizational policies, and/or state guidelines to make decisions. Today, we're going to review the update to the Alaska Imaging Assessment and the change to question number 4, and to introduce a new imaging assessment tool known as Imaging Assessment B or Trigger Assessment. This will be a new requirement based on the selection chosen in question number 4 of the Alaska Imaging Assessment. We'll also review documentation requirements for imaging requests, some provider resources, and a provider portal URL changes. The updated Alaska Imaging Assessment is still located in step 5 on the provider portal screen. You'll need to click that Add an Assessment button to start. And then following the steps, you'll want to, in step 1, click on the Select button for the title and choose from the drop-down box Alaska Imaging. And as you see here in step 2, it will populate under the list of assessments. And then by clicking on the plus icon on the far right of the initial assessment, you'll be able to open the assessment to complete it. Here's an example of the update to the existing imaging assessment. Note that question 4 has changed to include a list of CPT codes and an option to select Other. If the code you're requesting is not in the drop-down list, please select Other. The rest of the imaging assessment remains unchanged and still needs to be completed. Please remember to click the Save and then the Complete buttons to finalize the assessment. The new Imaging Assessment B, which is also known as a trigger assessment, will automatically populate on step 5 when you select Other in question number 4 of that initial imaging assessment. Completing the trigger assessment will aid us in providing a more efficient determination process. Prior authorization requests are reviewed for medical necessity and appropriateness using evidence-based criteria, state guidelines, and/or organizational policies. You'll want to click on the plus icon at the far right of the trigger assessment to open it and complete it. The trigger assessment has 3 clinical questions as presented in this slide. Please answer each of the 3 questions in the trigger assessment with a yes or a no as applicable. At the bottom of the trigger assessment, there will be an affirmation and 2 acknowledgement statements that need to be checked, and they are all required fields. Please read each one carefully before answering these statements. Click the Save button, pause before clicking the Complete button to finalize the trigger assessment. And remember to save and complete all assessments before submitting your imaging request. A training video will be placed in our website, and our contact information will be shared with you at the end of this slide deck should you need to contact us with questions. Remember that checking your dashboard and alerts will give you updates to your request. If you click on the episode number, you will have access to an abstract view of the case. This is a read-only option. If you need to work in the request, click on the IP or the OP under episode type, as this will open the individual case. Your alerts will show one time. After you open the alert, it will no longer be listed under alert, but the information will still be in the individual's case. There are many provider resources at our website. You can find many provider resources at the qualishealth.org directly, or you can go to comagine.org to be redirected to the Qualis Health webpage. If you hover over the healthcare professionals at the top of the screen and scroll down in the drop-down box to Alaska Medicaid Division of Healthcare Services page, and here's a screenshot of that page at Qualis Health or Comagine Health's website. It has a lot of resources, including, for example, the prior authorization that's listed here as number 3. We want to give a reminder to providers to use the correct URL for the provider portal. Starting August 1st, the message in the first bullet was sent to providers alerting them to the change coming. Starting on September 1st, the new URL with the Comagine in the address will be the only URL to access the provider portal. Also on September 1st, providers will receive a site not found message when they try to access the old URL that has Qualis Health in the title. Please update your favorites to the new URL to ensure a seamless transition to the provider portal access. Our staff is also available to assist you. Here are the toll-free numbers to contact Comagine Health when you need assistance. We're available from 6:30 a.m. to 5 p.m. Alaska time, Monday through Friday. I've also included the direct contact for myself, Lisa, and Yvette, and any of us are happy to assist you. I'll just pause there for a moment in case anyone needs to take those numbers down. So we're now going to go to the question section of the presentation. If you have any questions, I want you to type them into the chat, please, and I'll give folks a few moments to enter some of those questions. Lisa or Yvette, are you guys seeing any questions?
The only one I see is about sending the PowerPoint out for later use.
So we do have one question here. Will you be sending a copy of this PowerPoint so that we can review it again later? And yes, we will. We have training sessions today, Friday, and next Monday. And then this presentation, the recordings, and the slides will be posted for anyone to be able to look at. I have a great question. Can you interclick more than one CPT code? Yes, you can. That's a great question. Remember that you need to enter an assessment for each CPT code or request that you have for imaging. And depending on each one that you enter, if you choose other, if it's not one of those CPT codes that we had listed, then you'll have a trigger assessment, or that imaging assessment B that it's also called, populate on your tab step 5 for you to complete. I'll give folks a few more moments to enter some questions if they have any.
Teresa, there was a comment about asking to go back to the phone numbers and the new URL link.
Perfect, thank you. So I'll pause here for a moment for the contact information. And here is the information about the provider portal URL. So you just want to make sure that it's the one that says comaginpp.zomega.com that you're utilizing. You can use it now, and definitely starting on September 1st, you'll want to make sure that is the one that is either in your favorites or when you go into our on our web page in the upper left-hand corner, there is a link to where you can click to go straight to the portal, and it will be the correct URL for you. If you're using that one that says qualishealthpp.com, you'll want to switch over as soon as possible. Give folks another minute or two to enter some questions if they have them. These are great questions. Remembering that the assessment can stand alone if you enter all of the information directly into the assessment. You are still allowed to enter additional documents to help support your request. But we do want you to fill in the assessment as much as possible. You're also welcome to send a copy of that assessment to your providers and ask them to fill it out if that helps you at all, to make sure that we're receiving all of the needed information to conduct those imaging requests. And I'll pause here for a moment with the contact information again if anyone needs it. Lisa and Yvette and I are always available to help you. Either give us a call. If you email us, remember that we cannot accept personal health information in emails. You can use the reference number and say, I need help, or whatever your question might be. Give us a contact number to call you back at, or if you prefer an email reply, we'd be happy to. I have a question. Is the 888 number that is still in use, or are we using the one from the slide for review? Lisa, can you double check that for us real quick?
I sure can. I'll be right back.
Thank you. Have a question. Can you go over the acknowledgement slide again too? Sure can. Let me go back to that slide for you. So this is the affirmation and acknowledgement page. It's what's going to be at the bottom of that trigger assessment. Remember, there's going to be 3 clinical questions that you'll need to complete for those CPT codes that fall in the other category. We'll want you to read each of the statements and make sure that you're able to check the affirm or the acknowledge buttons prior to clicking the save and then the complete button, as this is a separate assessment. So you want to make sure you've saved and hit complete on both assessments when you have a CPT code that falls under the other category. Have a question. It says, if the acknowledgement box is not checked, are you able to proceed further? And as you can see, they are mandatory required fields. So you will need to be able to check those before the request can be submitted through the portal. I'm going to go back to the phone numbers. And actually, I do have an incorrect number listed here. The toll-free number is the 888-240-0437. And that will be corrected when you receive this slide deck. These are all great questions. Thank you, everyone. We'll just pause for a moment to see if there's any additional, because this is a little bit of a change coming. We want to make sure that if you have any questions, we can certainly go over them right now. As you start to work these in the very near future in the portal, if you have questions, please reach out to Lisa or I and Yvette. We can all assist you. You can always call the 800 or the 888 number, and the frontline staff will be knowledgeable about the changes also, and they can certainly assist you. Another great question. It says Teresa's area code correct. The other numbers are 206, but Teresa's is 208. Yes, that is correct. I am in a different time, a different place than Lisa and Yvette. So these numbers are correct. So I have a great question. It says, are we still not able to combine cases if the patient has 2 different cases submitted, but come in on the same date of service to have an MRI CT completed? Most CTs are not on the prior authorization list, so we would not be conducting a medical necessity review for that. That's one reason why we would not be combining cases for something that a particular request that would not come through Comagine Health. So I do believe at that point you would have two, you would have an authorization number from Comagine Health for the MRI, and then you might have be billing directly for that other code that's not on the PA list. That might also be a great question to reach out to Conduit about. In the next slide presentation, there will be some contact information for them when you're having questions about that. And I think this is a little bit of a clarification. Question is, are we still not able to combine cases if the patient has two different cases submitted, but come in on the same day of service to have an MRI CT completed? What if they come in for two different MRIs, like an MRI lumbar and an MRI brain? We would want you to try to submit that request together, but when they do come in separate, at this time, we're not able to combine them. But those are great questions. Let me pause and back up one moment and help clarify that one just a little bit more that I've thought about it. If they have not been decisioned yet, either approved or denied, then we can combine them if we identify that they were on the same date of service. But once they're decisioned, then they are two separate authorizations that have already been transmitted back to Conduit and to the state of Alaska.